Name is Sarah Baroni, and I'm going to be doing my CVAD dressing change for one of my skills for integration. For the purpose, I am using this line as my central line, and then I have all of my materials printed. So I have sterile gloves, mask, clean gloves, two ChlorPreps. I've got a tape measurer, bio bin, bio patch, Tegaderm, alcohol prep, and skin barrier or skin prep, whatever your hospital protocol has or whatever your facility has. I will check the doctor's orders before going into the patient's room, make sure that I have all the correct supplies. I'll knock on the patient's door, introduce myself, identify the patient using their name and their birthday, make sure I have the right name and the right birthday, and that we have the right patient, we're doing the right procedure. I'll go ahead and explain the procedure that we're doing a CVAD dressing change. I'll ask the patient if they have any questions, and then go ahead and answer any questions before doing the procedure. I also want to make sure that the patient doesn't have any allergies to any of my supplies that I'm using. And then just verify again at the bedside that I'm doing the correct procedure with the right patient. I'll go ahead and provide patient privacy, and then I will wash my hands with soap and water, and then I'm going to take my mask. Actually, you probably need two masks because with this procedure, you want to make sure that the patient is not facing towards the line. We don't want them coughing or sneezing or breathing on the line that could possibly cause an infection. So I'll wear a mask, and then I will have my patient wear a mask as well. I'll also ask my patient to turn their head away from the procedure site just to prevent that extra. We don't want the debris and the bacteria to get in there. So then I'm going to put on my clean gloves, and I will set up my bio bag to the side so that way I can place all my waste products in there. So the first thing that we're going to do before even starting this dressing change is assess how the line looks now. We want to assess for any redness, any irritation, any signs of infection, or that the patient might not be tolerating this line. If we see anything that looks suspicious, we want to report it to the physician immediately and let them know what's going on. So then when you're taking off the old dressing, we want to make sure to peel it carefully because we don't want to dislodge this line. We want to make sure that this line stays within the parameters of what it was put in. And that's another reason why we're going to need our tape measurer. So once we get this line completely off, we're going to use our tape measurer and we're going to measure how much of the line is out. So like I said, the purpose of this is to make sure that we are actually, by the time we're done with the dressing change, we have the same amount of line. That way we didn't accidentally dislodge some of the line and then maybe displaced it. And then what we will do is take our alcohol prep, and you're going to clean in a circular motion around that line and underneath that line. And what we're doing is we're creating like a type of seal almost, and wiping down like any type of bacteria that might be in the surrounding area from getting into that line and causing an infection. Once you're done with that, you're going to go ahead and place that in your bio bin at the end of the bed. And then you're going to take off these gloves because now we've touched it, it's dirty. And then we'll throw them in the bio bag as well. What we're going to do is you're going to perform hand hygiene again, and then you're going to apply your sterile gloves. So once you have your sterile gloves on, you need to make sure that you set up your field in a way that best suits you. So if you're left-handed, you need to set all of your supplies on the left. If you're right-handed, you need to set all of your supplies on the right, and make sure that you're not reaching over your sterile field or doing any type of cross-contamination once you have a sterile field and you have your sterile gloves on. And then you can dispose of the sterile glove contaminator. So then we're going to take our chlorhexidine and we're going to crack it. With the chlorhexidine, you just have to hold the two sides, crack it, and it'll come out like the circle area right here. And we're gonna do another like scrub around in a circular motion, but we need to do this for at least 30 seconds. So we have already done the alcohol pad, and now we're doing chlorhexidine because we really want to make sure that this patient is not going to get an infection. The line is not going to get infected. So you're going to go in a circular motion underneath that line for 30 seconds. Okay, make sure that we're scrubbing it down real well. Then you're going to place that in your biobin. Then you're going to get another chlorhexidine, crack it, and we're actually going to clean the line. So this time you're going to come from the inside of the line out in an outward motion, and we're also going to do that for 30 seconds because not only does the skin have a chance for getting bacteria, the line has a chance for getting bacteria, then that gets into the patient and then they can get an infection. So we need to make sure we're cleaning that down for 30 seconds. And once you do the 30 seconds, that goes right into your biobin. We need to make sure that the skin is drying properly. And by that, I mean, don't blow on it to like try to get it to go quicker or dry quicker. And don't do like this to try to get it to dry quicker, because then you're just introducing more bacteria and more chances of an infection, and you don't want to do that with these patients. After everything is nice and dry, you're going to take your skin prep and take that around the line here. And what that's going to do is going to create a little barrier here to protect the skin, because what we're going to do is we're going to be taping the tegaderm on top of it, and that could cause some irritation to the patient's skin. So we'll get rid of this. Now, before I put on a new bio patch and the tegaderm, I'm going to take a new ruler here, or paper ruler, tape measurer here, and I'm going to just measure one more time to make sure I didn't lose any of that line. We want to make sure we didn't dislodge, and if there is a discrepancy, you need to let the provider know like immediately so that they can make sure that this line is in proper placement. So this can go in your bio bag as well. You will take your bio patch on the bio patch side up, stick that right in the middle, and then you can open your tegaderm. It's a clear type of transparent tape, and it comes with a like a little white label on it. So when you open it, you're gonna place the clear tape on it, and then you're gonna place a white label on top of that. And what you'll write on the label is the date and the time in which you did your procedure, and then you'll go ahead and document, put your initials, and all of the trash can go right into the bio bin. Now you need to make sure that the patient tolerated the procedure well, and if they didn't, you need to document that right away. Document regardless how the patient tolerated it, how did it look before, how did it look after, exactly what you did. You need to have the date, the time, and if you notified the doctor for anything, you need to make a note for that. You always need to document everything, because if you didn't document, then it didn't happen. Make sure that before you leave the patient's room, you do another hand washing after you dispose of the bio bag in whatever your hospital facility protocol is. So dispose of the bio bins, dispose of the waste products, and then you're going to do another hand hygiene. Before you leave the patient's room, you want to do your environmental checks. So you need to ensure that the patient's bed is in the lowest position possible. You need to give them the call light, make sure it's within reach, make sure the brakes are on the bed before you leave the patient's room. Another thing that I think nurses should check for is to make sure there's no frayed wires or cords in the patient's room that could cause a fire or potential harm in any other way. And then I would always ask the patient if they needed anything before I left the room. And other than that, just document everything that happened, and document the entire procedure and how the patient tolerated the procedure. And that is it for CVAD dressing change.